Well, thank you very much. It's truly an honor to be here today to celebrate this, this incredible day in your lives. And such an honor to receive this degree. Dean Torty, Dean McNeil, Dr. Hesselbrock, Mr. Niederlander Sr., and other Niederlanders who are here. Trustees, directors, distinguished guests, in particular the members of the class of 2014, families and friends. It is an honor to be at the University of Connecticut Health Center to deliver the commencement address. At ABC News, I'm in the business of telling stories. And so I'm going to do that today. I use communication as a way to try and improve health. But because it's a graduation ceremony, I also have to give you some advice. One piece of advice I got for a guy who worked for me at CDC was give the bottom line up front. Give what people need to take away so that as you start to zone off and don't hear the rest of what I have to say, you'll at least have gotten the advice part of it under your belt. So here goes. Here's my advice, and there are three things. And the reason there's three things is that you learn in communication that people remember things in threes. So, okay, first, find your passion and go for it. You know, don't lose track of what brought you to the medical field in the first place. And when you're faced with a new challenge, embrace it. The bigger the challenge, the better. If you do that, you're going to be happy and you're going to help make the world a better place. All right, so that's number one. Okay, second thing, and this, I use social media a lot. I use Twitter, I use Facebook, and so I put out a question to my followers on Twitter and Facebook, what should I tell the graduates today? And it really is the second part of the advice, and that it has to do with listening to your patients. Everyone was saying, tell them all to listen. When they come into the room, listen. So the second thing is remember that being able to sit down with a patient is an incredible privilege. With that privilege comes responsibility to truly listen so that you can understand why they're there to see you. It may not be the first thing they tell you. Often it's not. Often it's that thing they say right before you walk out the room. And when that happens, you want to turn around, sit back down, and get down to business and continue listening. Okay, that's number two. Number three, remember to speak in English or Spanish or whatever language your patient uses, but don't talk in the language that you've been learning in school. You just spent your years of training, and many of you are going to spend many more years of training, learning a very specialized language, and that language helps you talk to other health. This thing is really incredible here. I'm going to move it to the back, okay? Otherwise, there's no way I'm getting through this. It's like it's like if you've ever been camping and there's a gnat that's flying around your face when you're trying to talk. So I'm sorry if I broke protocol. Okay, I'm going to break protocol again. Okay. Right. There's something that they teach you in television is if there's something odd about your tie, your shirt, anything about your appearance, people aren't going to hear a word that you have to say. And so with that thing flapping in front of my face, I think half of you missed out on advice number two. Okay, so you've learned this special language, but never forget that your patients don't know that language. And most patients will be too embarrassed or too shy to say, I have no clue what you just said to me. So try and speak in clear language, okay? And since there's some dentists in the room, I have a special piece of advice for you. Never, ever ask your patients a question when their mouth is open and your hands are in there, okay? I don't know why, but my dentist always does that, and I don't know if it's something that he learned in school, but don't do that, okay? So that's the advice part, and now I'm going to get on to some stories. I come from a family of doctors. My father was a gynecologist in a small town in New Jersey. He retired a few years ago when he turned 80. And my grandfather was a general practitioner in the Center City, Philadelphia. And my grandmother was his nurse, and they had a practice in the basement of their row house. And he retired when he turned 85. And I remember when I was graduating from medical school, my parents and my grandparents, they were very proud, but they were also concerned about where medicine was heading. And I remember my grandfather questioning whether the medicine that he practiced would be the same kind of medicine that I would practice. And currently I hear a lot of doctors who say, you know, if medicine was the way it is now when I was starting out, I never would have gone into this field. And I hear them out, but I totally disagree. I totally think they've got it wrong. It's so hard to anticipate what the field of medicine will look like over the course of all of your careers. But I'm filled with optimism. When I look at how my grandfather practiced medicine and my father practiced medicine, it has nothing to do with, very little to do with how medicine is practiced today. The eras are very different. But medicine has always been focused on the well-being and the health of the patient. And you enter the field of healthcare at an incredibly exciting time. And right now, there are more and more people who are getting access to healthcare, and that's critically important. You're entering medicine at a time when our understanding of genomics and epigenomics is just starting to blossom. And I'm filled with excitement, but also with envy. To be entering healthcare right now is to be embarking on an incredible journey with the potential for improving health and preventing disease across the globe like we've never known before. And I can't wait to see where the journey takes all of you. So a little bit about my journey. And here I get into some more of the stories. A couple years ago, it was the middle of August, and I was standing in a tent in the sweltering heat in a little village in western Uganda. And I was putting on what looked like a spacesuit so that I could enter into an isolation ward. Patients in there were infected with the Ebola virus, one of the deadliest infections in the world. There's no treatment for this disease. Some patients recover, others die a horrendous death. So I had full protective gear, rubber boots that I brought from New York because I knew they would never have rubber boots that fit me, a Tyvek suit, a hood, a mask, goggles, and gloves. And the expert who was helping me dress, he said this: whatever you do in there, don't touch your face. Some people panic. They can't breathe. The instinct is to remove your mask. Whatever you do, don't do that. So great. I thought, now more than anything, all I wanted to do was scratch my nose. So my cameraman was catching all of this so that I could show our audience what it takes to respond to an outbreak of deadly infection. My goal was to show Americans why new emerging infections halfway across the globe, halfway around the world, matter to us here in the United States. Tomorrow morning, I'll be reporting on Good Morning America about the MERS virus. The second case of MERS is being announced in the next hour at the CDC. It's in Florida. Why should we care about that? That's what I wanted people to understand. Although I was frightened, inside I was smiling. I almost couldn't contain myself, and I thought, it doesn't get much better than this. So how did I end up there, and why was I so happy about it? I can tell you that as a little kid, I never dreamed of growing up to be a TV doc. When I was graduating medical school and setting off for my residency, my goals were simple and my goals were big. I wanted to change the world. You know, I didn't say that out loud very much. I guess I didn't want anyone to tell me that I was idealistic or not serious enough, but that's what I wanted to do. I wanted to tackle some of the biggest health problems and health inequities that I'd seen during a year I'd spent after college traveling around the world to some of the poorest places on earth. I'd entered medical school with big ideas, and thankfully, I was able to leave medical school the same way. It wasn't easy. The endless lectures, rotations, and studying threatened to dull my intentions, but I worked hard to prevent that from happening. I worked my schedule to allow my last 5 months of medical school to allow me to do electives overseas, and I found the perfect spot. It was called Lady Willingdon Hospital. It was in Manali, a little Himalayan mountain village in India. And there, I was able to refocus my energies, restore my desire to change the world, and learn about the health problems faced by so many people in the developing world. It also challenged me in ways I'd never been challenged before. I was working with this doctor, his name is Laji, an incredibly gifted surgeon, and each day I would assist him in the operating room. I'd administer anesthesia. I'd hold instruments, help close wounds with sutures donated from overseas. Often the power would go out and we'd need someone to hold a flashlight over the operating table so we could finish the surgery. As my rotation was ending, Laji had to leave Manali for a week to attend a meeting, so he left me in charge. A fourth-year medical school in charge of a hospital that was seeing a couple of hundred outpatients a day. I wasn't going to have to do any surgery, with one possible exception. Before he left, he taught me how to do a cesarean section. Now, C-sections are done when a baby can't be delivered vaginally. And this can occur for many reasons. But when you face one of these situations, it's a true emergency. So patiently, before he left, he walked me through a C-section. It seemed pretty straightforward. He thought it unlikely that I'd have to do one, but given that we were high in the mountains, at least 5 hours from the nearest health facility, he showed me how to do one as a precaution. So off he went, and for the first few days, everything went smoothly. Then, a couple days before he was to return, a woman arrived in labor. Her water had broken, but she wasn't making any progress towards delivering her baby. She'd been trying for a full day and a half, and she was tired. Jane, our experienced senior nurse, examined her. The baby's heart didn't sound good. We needed to do a C-section right away. As we prepared the operating room, the church on the hospital grounds filled with staff who began to pray. In the operating room, others began to pray as I got to work. I positioned the woman on her side, and I put in a spinal anesthetic, just as Laji had taught me. I tested her legs to make sure she couldn't feel anything, and then began the operation. This was one of those situations in life when it's best not to know all that can go wrong. Confidence counts for a lot. As I made an incision, I could hear the loud prayers coming from across the compound. I maintained even breaths, working to keep my glasses from fogging up. After a few minutes, out came a baby girl. Blue, but otherwise okay. After a few moments on the warming table, she gave a cry, as did many others in the room. We gave her to her mother so she could begin to nurse. I closed the uterus, then the other layers, and helped move both the mother and baby to the maternity ward. You know, the feeling of doing that C-section was incredible. I'd never gotten a hit to win a baseball game, but it was that kind of feeling. It was the first operation I ever did on my own, and it was the last. But it gave me the confidence to be willing to take on any challenge that came my way. And the point I want to make is not that you need to rush out and do a cesarean section, but that throughout your lives and your careers, you're going to have choices. You're going to face challenges. Some will be challenges of your own making. Others are going to be forced upon you. I've always tried to look at each challenge as an opportunity. What can I learn from this? How might it allow me to pursue my dreams and my passions? And how can it make the world a better place? So, how did I end up in full protective gear in a Ebola ward in Uganda? I have to finish that story now. So after my pediatric residency, I embarked on a career in public health, initially as an outbreak investigator and a researcher, and then developing public health programs. And then in 2009, I was serving as the acting director of the Centers for Disease Control in Atlanta when the flu pandemic hit. And I became the face of the response. Each day, I'd hold press conferences during which I would translate complex medical information into plain spoken English. I'd tell people what they could do to protect their health. I'd empower them with information. Through polling, we saw that people were getting the message, and they were taking measures that would make them safer and healthier, and it felt terrific. ABC News saw me on the air, they liked what they saw, and they offered me a job. And of all the job opportunities I had, this looked to be the most challenging, and it had the possibility for making the biggest impact on people's health. So I went for it. So now I'm at ABC News, practicing public health in front of the camera. Don't tell ABC News that. They don't know that's why I'm there. But something I never imagined I would ever be doing when I was sitting where you are right now. So much of health is related to the choices that we make, about what we eat, how we exercise, how much we sleep. And each day, I get to give millions of Americans information in plain spoken English to help them make informed choices about their health. So to close, find your passion, whatever it may be. Step out on your journey. Don't be afraid of the challenges, because you never know what doors those challenges are going to open for you. In so many ways, we define and develop our own future by the choices that we make. And if you can find your passion and follow your dreams, you're going to be happy, no matter how medicine evolves, and you're going to make the world a better place. Thank you so much for the opportunity to celebrate with you, and congratulations to the class of 2014.